welcome to Your Health. I'm your host, Erica Cardenas. Today we're at the Holly Hart Children's Museum to discuss heart health. But before we get started, let's take a look at what's coming up on today's show. If you or a loved one has heart concerns, we have a unique opportunity to learn from the country's best doctors. And selecting the right doctor for your hearing health can be a challenge. We'll get some advice from the experts. Plus, a workout place that is designed to work around your schedule. All that and more on this episode of Your Health. Heart disease is the leading cause of death here in the U.S. In an effort to educate the community about heart health, we've got an incredible opportunity for you to learn from the top doctors in their field.
My name is David Reisig. I am the Chief Scientific Officer and the Director of Structural and Coronary Intervention for Honor Health. When you talk about the advancements in patient care, in cardiovascular care, Honor Health has been amongst the elite programs in the country, helping to develop and perfect non-surgical techniques, in other words, catheter-based techniques for the treatment of advanced and complex heart disease. One of the other programs we've been involved in is developing stents that actually dissolve or melt. Basically does what it's supposed to do, opens up a blocked coronary artery. However, then at the end of several years, it melts or dissolves so that the patient is not left with the consequences of a permanent implant. How did it feel to be a part of that breakthrough? It's amazing. I started working on that in 2006. And it wasn't until just about 2015 or 2016 that we really knew this is going to work. That was one of the proudest moments in my professional career because of the collaborative and team approach. It was a proud moment, and a proud moment for Honor Health. The Lampe Center is a tremendous success story for Honor Health. Patients have a lot of hoops they have to jump through. They have to go to this office and that office. The Lampe Center basically becomes a one-stop shop for those patients. It's going to help to drive patient care in a more efficient, higher quality fashion. Scottsdale Interventional Forum is a 4-day event in which we bring the brightest minds in cardiology and surgery. We bring them together under one roof. It's an exchange of ideas. It's a sharing of experience. We have what we started several years ago is our community event. We have an open forum where the community comes together to learn about heart disease, to be able to ask questions about heart disease. And they even get to witness a live case being performed by our own physicians, and they get to ask questions about that case. It sort of demystifies heart disease, if you will, for our community. It's a free event. It's our give back to the community for the years of support that they've given us.
A regular workout routine is a great way to increase your overall heart health. And when you have a place like Anytime Fitness, there are no excuses to not get your workout on.
When you walk in these doors, we want you to feel like you are a part of this community in here. We want you to be friendly. We want you to know us. We want you to talk to us. We want you to be comfortable in here. But we also want you to get a darn good workout while you're here too. One of the things that people find as an objection to exercise is time. I don't have time. Now, if you told me that, I'm gonna go ahead and let you know that you do have time. I'll show you exactly where you're wrong about that or where you do have time. But as far as the gym is concerned, we want to accommodate people with those busy, hectic schedules.
The nice thing about being a member at Anytime Fitness is not only is it convenient, as we're 24/7, but we also have great coaching services here. We got both the personal training, the group training, we have the app, So we can do virtual coaching. We can use the app to send you workouts, personalized workouts just for you based off of what your goals are.
A lot of people, they work hard, they get into it, and they fall off the wagon after 3 weeks. And we're gonna hold you accountable. We're gonna be there every step of the way. We're gonna give you a whole mapped out plan for the entire month. And after that month's over, we're gonna have a plan going forward so we keep you rolling, we keep you going. That's how it's supposed to be run, and that's how we run it here.
My name is Allison Hahn. I am a PhD student working on my PhD in communication and a Highland Games athlete, which basically means I put on a kilt and I throw heavy things. Usually have a 2-hour window where I can come and work out, and that means getting in, getting out, getting home, getting showered. So I really enjoy this gym because it's close to where I live, it's convenient, it's open at all hours, and I never have to wait for anything. I can just go do what I need to do and get out. Coming to Anytime Fitness means that I actually have a wide range of weights to work with. There's good squat racks here, there's good drop pads here. The equipment is high quality, and you'll find something for every skill level that you need.
One of the reasons why I wanted to own Anytime Fitness is I want to help people get to where they want to be in life, to reach their goals. We want people to better their life, whatever it is. Maybe it's a small thing. Maybe they just want to run down the street with their grandkid. Maybe they want to be able to ride their bike with their kid. It doesn't have to be the big jump to lose 100 pounds or get ripped. It's the small goals, and it's being able to live life better that we can help you with.
Door's always open with exercise, and it's never too late to start. And we've had people think that they're over the hill and there's just no point. Well, no, there's definitely a point. If you can still extend your life and live a higher quality of life, why not do it?
The American Heart Association says being physically active is one of the most important things you can do to prevent heart disease and stroke. They suggest getting at least 150 minutes per week. 30 minutes a day, 5 times a week is an easy goal to remember, so get up and get moving. Here at the Holly Hart Children's Museum, they aim to educate in a fun way, like this oversized heart display that gives visitors a look at how their heart works. Pretty cool. Here's what's coming up. What should you be looking for when you select a hearing specialist? We've got the answer for you. And we'll talk about how to maximize your heart health with some simple tips. When it comes to picking a provider for your hearing health, the experts say you should be looking for some clear signs. Let's take a look.
Hi, my name is Kathy Kurth. I am a doctoral degreed audiologist here in the Scottsdale area. We have 3 locations, all in Scottsdale. We've been here for over 35 years, providing hearing evaluations, treating hearing loss, non-medical hearing loss, which is most of what we see today, providing all the most up-to-date technologies that exist in our field today. We have several audiologists, doctoral degreed audiologists. We also have hearing instrument specialists. So we pull together a team of providers to enable each and every one of our patients to gain the best possible hearing, maintain that hearing, and address any questions, problems that they may have with their hearing and their hearing instruments. I always suggest that each potential patient looks for that individual, that provider, audiologist or hearing instrument specialist who can give them the most information, the most knowledge, to help them make the most informed decision. Know what your hearing loss is, know what your treatment options are, and know what's ultimately going to give you the greatest success in better hearing in all the environments that you're struggling now. Hearing aid technology has changed dramatically today, and we've got lots of research that tells us it's what we need to do to get the information clearly, accurately to the brain, not just make it louder. And this is why people really need to do their research to find the best provider to give them all those options. I think if you go in prepared, asking the right questions, you have an opportunity to build a rapport, a trust with that individual. I would continue working with that person. If you feel any doubt or we always get those gut feelings about, this just doesn't feel right. That's when I say get that second opinion. If somebody is more involved with trying to sell you a product, that's when I think you want to have that instinct that says, let me go investigate further. Seeking out that audiologist who can provide and walk them through the steps of better hearing will help them in making their own best decisions. It's not about price, it's about the outcome. What will allow me to go to the movies and go to the theater and get together with my friends and my family and be able to be an integral part of that situation, to be able to hear and understand instead of just sitting there and nodding, not having a clue of what went on at that dinner table. So take advantage of free hearing evaluation to learn more about your hearing. To ignore it doesn't make hearing loss go away.
We're here at the Holly Hart Children's Museum to talk about heart health. And joining me now is Stacy Johnson. Welcome, Stacy.
Hello.
Hi. So first we're going to talk about overall heart health. What are some musts that we all should be doing?
So heart disease and stroke impact more people than all forms of cancer combined. And the good news is that 80% of the risk factors are mitigated through lifestyle changes. And this is things like exercising, quitting smoking, knowing your numbers like your blood pressure, your cholesterol.
Okay, now something also very necessary to talk about, heart attacks. What are some of the warning signs, and do those signs differ between men and women?
Right. So some of the warning signs would be the typical ones that you know, like chest pain. You might have pain radiating down your arm or in your jaw. And in women and men, they do manifest differently. And sometimes for women, they can even appear almost flu-like. So if you have any question, consult with a medical professional.
Stacy, you're a mom of 3, so talk to us. Tell us, why is heart health so important to you personally?
So for me personally, my father had his first heart attack before he was 30, and his dad and his brother all died early, before 50. And now I have 3 boys, so heredity is not on their side, so that's why it's really important to me to mitigate their risk factors.
So talk to us about the Go Red Luncheon that you have coming up.
Right, so on February 23rd, the Go Red Luncheon is coming up, and that's a great opportunity to learn about all the things we've been discussing. My favorite part is all the different speakers. They just tug at your heartstrings in a way that is just unbelievable, and the learning that you get to carry on forward to your family and your community is enormous.
Wonderful. So do you have any last tips or reminders on how to maintain a healthy heart?
I like simple tools, and so the one that I use is called Be Happy. So imagine the letters Be Happy,
Okay.
and each one stands for something. So B is breakfast. Get your metabolism going first thing in the morning, eat it. E is exercise. 30 minutes is just 2% of your day. H is hydration. Water, 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 especially here in Arizona, right? A, X, or add just one thing. So maybe you could add an hour of sleep, something, just one thing. P, plate 2 fruits.
Okay.
P, plate 3 veggies. And then Y is 15 minutes of you time, whether that's reflection or reading personal development, meditation. So if you do Be Happy every day, you will inherently mitigate your risk factors.
And a great thing to take into 2018.
That's
Be
right.
happy.
Right.
Okay, well, thank you so much, Stacy. Thanks
Thank
for
you.
joining us. If you'd like more information on the luncheon or on heart health, just head to their website. Coming up, now that the holidays are over, it's time to get you on track with your diet. We'll show you a program that can get you on course.
I'm Dan Osley. I'm the Surgeon-in-Chief and Chair of Surgery at Phoenix Children's Hospital. The Department of Surgery at Phoenix Children's Hospital is really an all-encompassing department of surgery. We have 9 divisions that cover all areas of surgical specialties. Those 9 divisions include general surgery, neurosurgery, orthopedic surgery, urology, ophthalmology, ENT, plastic surgery, dermatology, and congenital heart cardiac surgery. We've been very fortunate. We've been able to add all 9 disciplines now. Prior to about a year and a half ago, we didn't have that. So we've now added pediatric general surgery, pediatric otolaryngology, pediatric plastic surgery, and that has really broadened what we can do. There's a lot of crossover between those disciplines. It's not uncommon for us to have an operation that requires 3 different disciplines to do it. And now that we're all on the same team, so to speak, it's only going to get better. Every single provider that exists inside those 9 surgical specialties have all been trained in whatever subspecialty of pediatric surgery that they do. That's unique because not every place in the country does that. Some places have adult trained surgeons doing pediatric surgery cases, which is accepted in some places. In our organization, we truly value that extra training, that focus on just pediatric surgical care. The surgical outcomes here are as good as any place I've ever been. The patients and the families should expect that they can get the best outcome here as they compare to any place else in the country. If you look at our congenital heart program, we're consistently ranked in the top 5 in the country with outcomes that beat pretty much every other hospital. We have something called an ODE ratio, which is the observed to expected ratio for an operation. The observed to expected ratio for cardiac surgery is currently at about 0.53, which means that we save 2 children for every one that should have died. That's the kind of quality that we're expecting to give every one of our patients. In addition, we have a very strong trauma department. It's been on the cutting edge of research, specifically looking at blunt abdominal injury. So we're trying to figure out the best way to manage blunt abdominal injury, saving organs that would normally have been taken out, as well as shortening length of stay. Another important program that we offer here at Phoenix Children's Hospital is transplantation for solid organs. There's 3 types of transplantation we do: cardiac transplantation, we do liver transplantation, and kidney transplantation. If you look at in the neurosurgery arena, for example, we now have the ability to ablate tumors without large craniotomies. In the general surgery world, we do the most advanced minimally invasive surgery in tiny babies where we don't have to make big incisions. We can do it all through a scope and tiny instruments. So I think the technology side of what we're willing to commit to at the Phoenix Children's Hospital is as good as anything in the country as well. So if you look at the staff, the people, and the technology from the surgery standpoint, I don't think we can find a better place.
One of the best decisions you can make in your heart health is to not smoke. The museum uses this giant artery display to show kids how smoking can block your arteries. A great demonstration for all. Stick around, we'll tell you about a Weight Watchers program that will get your diet on track. If the holiday season has wreaked havoc on your diet, the folks at Weight Watchers have a great way to get you on your way to better health.
What I love about Weight Watchers is it's always evolving. And so it is based on the up-to-the-minute science. So this is not your mom or your grandmother's Weight Watchers. This is new and this is exciting. So we're looking at things differently. We're looking at food. We're looking at fitness. We're going to encourage you to move more than you have before, and that's a great thing. And we're going to focus on the mindset, which I think is a huge change. Weight loss starts from the head and moves its way down. We talk a lot at Weight Watchers about our why, don't we? The reason that we walked through the door, the reason that we're here. I love being a Weight Watchers leader because I get to see people at their best, even if they're not at their best that day.
After kids, it was really hard to kind of, bring off the weight and stuff like that. It's so hard.
I had spent some time with my kids outside and couldn't keep up with them. And I have 4 kids and they're crazy, and so I knew it was time to do something that was going to work this time.
I really resonate with moms I joined Weight Watchers after my first daughter was born, and I had been a chubby child. I'd put on weight as a newlywed, but when I got pregnant with her, I thought, I don't want this to be the rest of my life. So I joined Weight Watchers because I needed friends, I needed accountability, I needed a leader who would love me to goal. I lost over 60 pounds, and that baby is now a junior in college. So it has become part of my life, and I'm so grateful for it. This plan is not one size fits all. We all do it differently, and that's why we're here to support each other and to share ideas and to laugh and to celebrate and to cry and all of those fun things that we do. I love the moms that come in carrying a baby in the carrier and they just look so lost. Learning that it's okay to take time to do things that are important to you is a huge valuable lesson that every man, woman, and child should learn. And so as you're watching these moms come in so overwhelmed, and pretty soon they're learning, okay, I'm worth the time that it takes to cook my own meal.
This is my first time doing Weight Watchers, but I did hear a lot of good stuff about it through doctors, who were always constantly telling me about my weight. I used to say, like, in my head, if you'd only know how hard I was trying.
With the Weight Watchers program, we encourage members to make small changes. Here's the most beautiful thing about activity. If yesterday you went 2 steps and today you go 3 steps, you have accomplished something fantastic. It's maybe taking a few more steps. If you have family come into town, our weather's beautiful. If they come into town, instead of taking them out to eat, maybe we go to a museum. Maybe we go on a nature walk. Those little things that add up to big weight loss and big changes. And the changes are what we're really looking for.
Sarah's amazing. She really makes it a point to make everybody feel like they've won at something for that day or that week.
So if I can come here and celebrate, if I can share stories, if someone bought something that I can try that I love, if someone can cry and say they had a rough week, and I can then say, I had a rough week too, this is hard. Or if we all celebrate together, that's a great thing.
We want to thank everyone here at the Holly Hart Children's Museum for letting us explore today. This is such a fun, interactive experience for the entire family where you can have fun while learning about good health. Here are a few more tips on keeping your heart healthy. Practice good dental hygiene, especially flossing. Gum disease puts you at risk for heart disease. Don't sit for too long. Experts say staying seated for long periods of time is bad for your health, no matter how much you exercise. And avoid secondhand smoke. Studies show the risk of developing heart disease is about 25 to 30% higher for those exposed to secondhand smoke. Thank you for joining us. I'm Erica Cardenas. See you next time.